populations differently
Meeting is being recorded.
differently than other flu viruses. So a normal flu virus has what we call a U-shaped curve to it, and that is that when you think about it in terms of the mortality curve, that's what it sort of looks like. It attacks the very young and it attacks the very old. And we're pretty used to that messaging during our own annual flu seasons that the very young and the very old need to be particularly careful. In 1918, this particular strain of influenza, H1N1 flu virus, actually had a W curve. So it went like this. And what that meant was that it attacked people in the 15 to 34 age group with a severity and an intensity that had not been seen before. And when we think about the average age of flu victims, the average age of flu victims in this pandemic were actually 28 years old. So it was very, very young. And so that was unusual about it. I just have a few more things I wanted to mention. The, the fourth thing I wanted to mention was its longevity. The flu epidemic actually came in 3 waves. There was an early wave in the spring and summer of 1918 that was not too severe. We probably wouldn't be talking about it if it had just ended there. But then the virus mutated and it came back with a vengeance in the fall of 1918. And when we think of the Spanish influenza epidemic, the large numbers of deaths, the second wave is really the most lethal one. And in 1 month alone, October of 1918, we had almost 200,000 Americans who died. Um, Two more things just to kind of wrap up and actually get to the conversational part here. A lot of people always want to know, why is it called Spanish influenza? Why do we call it the Spanish flu? And that really had to do with the war. Because of wartime restrictions on press, on the press, there was a lot of censorship throughout the world. And so when the flu first popped up, a lot of nations that were fighting the war did not want to create panic or concern among its citizens, so they suppressed information and news of the flu. Spain, however, was a neutral nation, and so when the flu broke out in Spain, it freely reported on it, and so the flu developed the nickname the Spanish flu. Something I should point out, the Spanish did not appreciate. And then the final sort of big stroke thing that I wanted to mention was where the Spanish flu sort of falls in history. I started off by pointing out this is indeed the worst pandemic in modern history. It's probably not the worst pandemic in all of history. Most historians think that the Black Death, the bubonic plague, that occurred in the 1300s was actually more lethal in terms of the percentage of the population that was killed. And then of course we don't know what's going to happen now, but my suspicion is that that what we're living through right now is not going to reach the scale of what occurred in 1918.
That's very interesting, Jennifer. Can I go back to the remark you made about why it's called the Spanish flu?
Sure.
And you mentioned that because of censorship um, in the wartime countries, and I would assume that means including America, that it was not reported to be widespread, and so the only place it was known to really exist and be persistent was in Spain, which didn't have those wartime censorships. Can you talk? Is that right? Was there censorship of it in the United States as well, or it just was not a very well known or very prevalent disease then?
Well, I think there were a few things that were going on. One was that the for a country that was at war, the news that was really dominating in terms of the press, newspapers, speeches, things like that, was the war news. People were really concerned about the war. So a flu popping up is not in itself initially noteworthy, because this is something that happens on an annual basis. It still happens to us on an annual basis. It was in Spain where they first began to openly report that this virus was acting differently, that there was something unique and especially lethal about this virus. It wasn't that in the US, as the virus, as these waves, took their course, that all news was suppressed. It was impossible to suppress it, in fact, because public health measures needed to be taken. But there was not, for example, now when you open up the newspaper, you can't read about anything else. I mean, this is the drumbeat. This is everything that you're reading. At this time, there was an effort to sort of not create public panic, to make people feel that it was under control. Certainly when the virus appeared in different cities, officials did similar things like what we're seeing now in terms of shutting down schools and churches and meeting places and movie theaters and enacting public health measures. And they wanted to use the press to be able to publicize those. But it was very much in the vein of it is possible for us to control this. It is possible for us to take positive action. So it's not so the Spanish flu is because that's where it was first reported widely. But obviously, as the epidemic went on, newspapers reported it. People had to talk about it because measures needed to be taken.
Yes. So talk a little bit more then about the flu pandemic's connection to World War One.
Hmm. Hmm.
And both, I know some of our folks out there are wondering, what's the connection? What were the causes of the flu going from a localized epidemic to a global pandemic? What role did the war have in that? And some of the readings that we sent along for folks to take a look at suggest that there was a role for the war effort in that. Could you talk a little bit more about that?
Sure. I just want to clarify one point, though. Although it was in Spain where the virus was first widely reported, the virus did not originate in Spain. So, in that sense, the Spanish really do have something to complain about, as we keep calling it Spanish flu. When we think about the role of the war when it came to the flu, you have to imagine, I mean, when America and all the nations really are mobilizing their populations to fight this war, the kinds of things that they're doing. So they're putting populations into contact with one another who have not, previously been in contact. Um, Taking men, putting them in training camps, pulling them, say, an example in the United States, people from cities, people from rural areas, putting them in training camps where they housed in barracks with hundreds of other men. They're marching around the fields. They go to eat. They're in mess halls. They go on trains. Then they go on ships, and then they arrive in France. Everything in their experience is about putting them in contact with in close quarters with other people. How you're mobilizing your society. You've got people working in factories, attending demonstrations to support the war by maybe buying Liberty bonds or at least showing their patriotism. Again, another way that you're encouraging people to congregate in large groups. And this literally is a breeding ground for the influenza virus. I mean, we've all been ordered now well, I'm in California, so shelter in place, avoid all large gatherings. We've been instructed about how coronavirus is transmitted. I mean, coronavirus is not influenza, but they act, at least it seems, in similar ways. And so, just the conditions of the war actually were promoting the spread of this virus. And then, of course, you were taking peoples and moving them all over the world, and so this transmits the virus globally. The other thing to consider is that the war prevented some kind of wide-scale measures like what we're experiencing now. People at the time could not just shut the war down. So there was a sort of cost-benefit analysis that was constantly being made about, well, we know that doctors already knew that by putting, say, for example, men in training camps who had not come into contact with each other, they were likely going to have to deal with some epidemics. They expected it to be measles, meningitis, things like this. Um, and so even though doctors understood the benefits of quarantining and social distancing, physical separation, they had to balance that against the need to train these men and get them over to France early, and to also have the public do what it needed to do to support the war. So I think that we can kind of see some really important ways that the war contributed to this. And finally, what was happening in terms of medical personnel. As civilians began to fall sick in large numbers, their health facilities were overwhelmed, not a surprise. But that situation was exacerbated by the fact that over 30% of American doctors were in the military now. And so even the numbers of medical personnel to service the civilian population had been severely diminished because of the war.
The war really allowed the disease to, put it this way, to metastasize throughout the population and took away some of the frontline personnel who could have and otherwise would have been responding to this.
Sure, because like think of what's happening now. So we've basically shut down plane travel, right? That's the way that people are suspecting that this virus, was being transmitted so quickly throughout the world. But in World War I, they're not shutting down trains, they're not shutting down ship transports. I mean, because the war necessitates that these things can continue. And in the US, it was exacerbated by the fact that we had entered the war so late. I mean, we didn't enter the war until April of 1917. And there was a real fear in the winter of 1918, if you know much about the course of the war on the battlefield, that Germany was on the brink of winning the war. And so in March of 1918, Germany launches this massive offensive against the Allied forces trying to win the war before the Americans come in force. March 1918 is exactly the moment that the second influenza wave, that the influenza virus, the first influenza virus appears in rural Kansas, which many people believe is in fact the origins of this pandemic. And so the course of events, the way they're colliding, don't really lend themselves to shutting down the world transportation or international travel in the same way that we're attempting to do today.
And it does seem like we see that even in one of the documents that you selected for us to read, Ernest Gibson's
Right.
account, where he says, and I'm reading on page 591 of the account, it's on the first copied page, he says, the number of sick increased rapidly. Washington, D.C. was appraised of the situation, but the call for men for the Allied armies was so great that we must go on at any cost.
Yep, exactly. And I mean, this also translated into the civilian population as well. So Philadelphia had a really famous example in September of 1918, where they were advised not to be holding this massive Liberty Loan campaign parade, because the influenza virus was ravaging the city. They went ahead with it anyway. It drew thousands of spectators and participants, and literally the next day, there were 600 new flu cases. And so this really showed that even the kind of large-scale patriotic demonstrations that you wanted to have to rally support for the war were almost becoming death traps for people. And in that account that you have of the troop ship, I mean, imagine that. And this was what became so disheartening for people. And it was part of the reason why also authorities didn't want to publicize these numbers too widely, because it made people start doubting the government and doubting the ability of the federal government to really manage this war effort effectively. I mean, if somebody goes into the military and they're conscripted or they join, they understand that they may fight and die for their country. But nobody thinks, well, what I'm going to do is die of influenza, on the ship transporting me over to France. And so those ships were just, people were stuck on them for 3 weeks. Once influenza broke out, there was nothing they could do. They had to just hope for the best until they arrived. So that's really at the height of the epidemic that we really see these kind of heartbreaking stories. And yeah, a sort of understanding, but also a sense of anger. And the real anger happened with the third wave. So I didn't really delineate these waves. So the first wave occurs in the spring and the spring and summer of 1918. The worst wave is in the fall of 1918. But then there's a third wave in the early winter of 1919. And that's the one where there's, censorship's lifted. People are openly, soldiers are openly writing home about what's going on. And that's the one where you see people really angry because, the armistice is declared November 11th, 1918. Everybody's like, phew, lived through the war. And then another wave of influenza goes through army camps in France, where American soldiers are literally waiting to get on a ship and come back. And that, well, if you die then, that's when families really hit the roof. And that creates a big political backlash against the Wilson administration where they're really accused of mismanaging the health of soldiers as they wait to come home from the war.
Like that, some folks have asked some good, interesting questions about also about the causes of the severity and virulence of the outbreaks. You mentioned that it happened, that it's understood in America at least to have originated in a remote army base in Kansas. Was that part for the pandemic for the entire world, or was that the American part of it? But we historians believe it started elsewhere in other parts of the globe.
So I put this in the category of questions that don't have answers. So there's even 100 years later of studying the flu, there is still a pretty ongoing debate among historians about exactly where the flu virus originated. Um, so there's sort of three candidates: France, the U.S., and China. And this, in 1916 and 1917, there is an outbreak of flu in some camps in France and parts of England. And the question here is did that virus die out, or is this the seeding event for the 1918 version? And there's kind of a similar question about a flu that broke out in China in 1917, and did that get transmitted to the United States as Chinese laborers who were being transported to France? And they crossed in railroad cars across North America. Did they actually bring the flu? And then the third one is, what has been probably the most accepted and longstanding explanation, which is that it's an avian flu that, like influenza viruses, that they're housed in animals, this influenza A type, and then it doesn't often go to humans, but when it does, it's particularly virulent because humans have not built up any previous immunity to it, and that this actually occurred in Kansas. So there's no real agreement on this. There's some speculations. There's been a lot of research done to try to figure it out. But given the record keeping of the time, it's not that easy necessarily to track. Um, on the question about why it was so deadly, which I think was your other question, am I remembering that correctly?
That's right.
Yeah.
Yes.
So why was it so deadly? So here again, there's mostly speculation. I mean, not speculation, educated, I guess, educated guessing. Maybe that's what we'll put it here. And maybe a few things to consider. We've already considered the war, which certainly, helped intensify its spread, and intensify the speed through which it circulated throughout the globe. I think the other thing to consider is the general health of the population at the time. For the most part, 1918 was a very different moment health-wise for the majority of the population. Um, Tuberculosis was rampant, measles were rampant. I mean, we lived in an era where epidemics were not necessarily common. The, America and much of the industrialized world was still powered by coal, so respiratory diseases were also much more prevalent. Um, and, and in a sense, there was a lot that medical science did not understand. So at the time, viruses had not yet been discovered. They were not discovered until the mid 1930s. So doctors didn't, they kind of they sort of understood from observation, what was working and what wasn't working in terms of preventing the spread of the virus, but they didn't know it was a virus. They thought it was bacteria. They weren't a bacterium. They weren't completely wrong in the sense that many people died from flu-related pneumonia. So they did in sense have a bacteria-related disease, but because they didn't have much that they could really do. So they didn't know it was a virus. Their antibiotics had not yet been created to fight those secondary bacterial infections. They didn't have mechanical ventilation, ventilators, so there's nothing like that. There's no vaccines, there's no antiviral drugs. So in a sense, they were sort of limited by what medical science had not yet discovered. I should point out, however, that they understood what they didn't know. And in the post-war period, trying to discover answers to those questions, in fact, spurred the very research that we now benefit from. So it spurred medical science to, in fact, investigate what this was and ways that they could potentially mitigate death. So a lot of things we're benefiting from today, the knowledge that it's a virus, antiviral medications, flu vaccines, ventilators, all of these things are ways in which we sort of live in the shadow of the 1918 pandemic. They're ways that medical science over the decades responded to the flu to prevent another type of pandemic of that scale taking place.
And it does strike me as important as I was looking at the memo that you had us look at from the Division of Sanitation on influenza.
Yeah.
And it struck me as it's 1918. They immediately understand that, as they say here, influenza is caused by a germ, the influenza bacillus.
Yeah.
So I think it's important for us to remember that the germ theory of disease, if I'm right, was only then about 40 years old or
Hmm.
so.
Hmm.
This was a massive change had taken place in science with only the last 4 decades. So perhaps it's not surprising that medical science was just beginning to think about and apply the lessons of this new understanding of how disease is spread and therefore could be treated.
Right. And if you take a look at that, you'll see that even though they didn't understand, well, they didn't know what viruses were, they had a pretty good sense of how it was being transmitted. So a lot of the advice, which is going to look very similar to us, I mean, had to do with things like wash your hands, cover your mouth when you cough or sneeze. Don't spit. Not spitting was a big thing because they had this idea that the germ was being spread through droplets. So you spray your sneeze, those droplets land, somebody touches it, they touch their face, they get sick. So not spitting was a big thing, and you would see signs all over the place about warning people not to spit. You could be fined if you were caught spitting in public. There's some funny stories, like in New York City, of Boy Scouts walking around and handing people cards, reprimanding them for spitting in public. And so there were definitely ways that when you look at the public health measures that were being taken, that they understood that putting people in crowded indoor situations, and then also the ways that people who were ill could physically transmit the germ, they thought, to other people through their sneezes or coughs. They did understand that. And if you think about, so this idea of physical distancing, they embraced that wholeheartedly. And so shutting down some of the things that were possible, cities would shut down, like schools and churches and public gatherings. But what they also did was they sort of moved a lot of things outside. So they understood that fresh air and being outside of closed spaces could also be beneficial. So for schools or courts or um, even some gatherings like funerals, church services that didn't want to shut down completely. They just moved their gatherings outside in the fresh air, keeping your windows open at night, taking walks, getting exercise. I mean, being outside was one of the recommended courses for people in terms of going about their daily life, but still um, hampering the spread of the flu.
You had mentioned earlier that the third wave in winter of 1919 caused a political backlash for the Wilson administration.
Mhm.
They had not done enough either to address the disease or to protect the troops that had fought so valiantly in World War One. Could you talk a little bit more? And we've got a number of questions from our participants about the effects of the flu pandemic, the effects on American society. You talked a little bit about the effects that it had on American medicine and spurring medical science to really get
Mhm.
serious about developing applications to fight influenza and understanding it more deeply. But can you talk a little bit more about the effect of it on American society, the effect of it on business and economics? We have the sermon from Reverend Grimke
Mhm.
on sort of the understanding the meaning of it as a kind of revelation by God to us about racial attitudes and almost as a divine reminder or even punishment on the United States. So, could you talk a little bit more about, in the various aspects of American society, the effect that this catastrophic event had?
I think that what's interesting about the Spanish influenza epidemic is how localized the experience really was. There was no coordinated federal response. So when I talked about people being angry at the Wilson administration in 1919, well, in a sense, that's because you give your child to the government to fight this war. The government, it's the federal government that clearly has responsibility for his well-being. But for the most part, there was no federal response. Woodrow Wilson never spoke about the flu to the American public, even though he himself came down with the flu. There was no what I can't even remember what the trillion amount is now of the bailout, or the aid that's going to go to Americans in the coronavirus situation. But there was nothing like that. There was no emergency relief for people from the federal government, no federal agency that was reaching out and sort of managing it in a nationwide level. Cities, in a sense, had to devise their own solutions, and it was a very localized experience in that respect. And so this is why you see such a patchwork of reactions, and you see them occurring at all different times. Some cities completely shut down, like Seattle. Other cities, like New York City, never shuts down during the Spanish influenza epidemic. What they do instead is they try to sort of spread out the workday so that they can reduce, for example, crowding on the subway. So they give different industries different work times. So they don't want to shut factories down, and they deploy a whole sort of army of volunteer nurses to different neighborhoods and different places where the influenza epidemic is really ravishing. Sort of demonstrating that good nursing care was one of the only effective ways that they came up with in terms of ministering to the sick once they actually fell ill. And I think you could see that actually in one of the excerpts that I gave from Pale Horse, Pale Rider by Catherine Ann Porter, where you see that as she's suffering from influenza, it's really the nurse who pulls her back to life, and it really demonstrates the importance of good nursing care in all of this. And so in that sense, it was sort of experienced locally, and also very personally. I find one of the interesting things about the Spanish influenza epidemic is that despite its severity and the large numbers of people that died, which meant that it touched hundreds of thousands of households. Right? I mean, you don't have this many people fall sick and this many people die without this being a common experience of the era. But almost immediately, it was forgotten, even by the people that lived through it. I mean, Catherine Ann Porter's account is unusual. It's hard to find a lot of, accounts 15, 20, 25 years later of people who still remember the flu and still are talking about it. Medical science remembered it, the doctors remembered it, and I talked about how that spurred all this research. But there was no real lasting, say, political fallout for the government, again, in part because of the war. Because right when you have this third wave of influenza, taking one last toll on the army, on American civilians, you have the Versailles Peace Treaty being negotiated. That's what everybody's talking about. That's what everybody's focusing their attention on. And so it's interesting that the war is estimated to have killed probably 10 million people worldwide, at least combatants. I mean, the civilian toll is harder to judge. Influenza killed 50 million people worldwide. We commemorate the war. We remember the war. There are memorials all over Europe, all over America to the war. But there's nothing that's commemorating the Spanish influenza epidemic. So this sort of is forgotten, and it's only remembered at moments like this. Like periodically we come back to it when we're afraid, oh my gosh, are we potentially going to live through something similar? But that's where its sort of lasting impact is a lot harder to judge. Like I've said, you could see that in 1918, the life expectancy drops. You can definitely see the impact that it had on medical science. But other than that, in terms of really defining like a lasting economic impact or a lasting political impact, it's much harder.
That's interesting. Some folks have been asking, and going off your last comment there, um, there was no, surprisingly, I guess, because of the war overshadowing the event,
Yeah.
and the desire of the world, I guess, after World War I to return to normalcy, in that phrase.
Yeah, I think that's a great way to put it, because really what the influenza epidemic is just like more death. So if you think about all the death that people are having to absorb in this period of time, death on the battlefield, death, and the Spanish influenza epidemic was massive, but there were other epidemics. There was a huge typhus epidemic in Eastern Europe at the end of the war. Because of poverty and starvation conditions there, and and the issues with sanitation. There were humanitarian crises throughout the war, all these displaced refugee populations, and then you had Herbert Hoover, who was organizing humanitarian relief northern France and Belgium to help prevent starvation among especially women and children, but refugees in general. And so it is really true that this pandemic is experienced at a moment when death, destruction, unprecedented scales of fatalities are being experienced or observed on multiple levels. And so I think when you consider that in the 1920s, people literally wanted to turn the page and let's just put this behind us, that the Spanish influenza epidemic falls into that category. But the point is also that we don't forget the fatalities on the battlefield. We do commemorate those. We do memorialize those. So it does show also that in that moment, how you die and by what means you die, your death takes on a different significance in larger popular memory and in American society. A battlefield death must be commemorated. A death by influenza can be forgotten, which it has been.
Yes. So can we talk a little bit more about the what you mentioned there, the medical professionals who were engaged in this?
Sure.
Folks wanted to ask about the American Red Cross and
Yes.
its efforts in nationally trying to mobilize nationally to combat the influenza
Yeah.
pandemic, and also the effect that the pandemic had on the health and well-being and the understanding of medical professionals like nurses and doctors.
Sure, that's a great question. So one of the things I didn't mention before, people probably know this from the images from the era, is that obviously wearing masks and sterilizing bed linens and clothing. These were common practices for medical professionals, anybody who was dealing with the ill. And so that was the advantage of germ theory, that they did understand that they needed to, the medical professionals themselves needed to be taking precautions as they dealt with the sick. Now, needless to say, again, sort of similar to today, the health professionals were on the front line. So it was not uncommon for doctors and nurses to themselves come down with the flu. They were putting themselves at risk by actually ministering to the ill, despite the precautions that they were taking. But I do like the emphasis on the American Red Cross, because what's always phenomenal to me is the way that when the Red Cross begins to put out calls for additional nurses, and they're mostly looking for volunteer nurses who can very quickly learn how to care for people who are falling ill from influenza. How many women step up and agree to do this? And this is a time where people know it's dangerous. They know that they need to be taking precautions to save themselves. But hundreds of thousands of women in their local communities actually step up and either are doing simple things like bringing food to people who are quarantined in their houses, providing them with clean linens, making sure that they have medicine that they need, all the way to actually caring for them in hospitals, often makeshift hospitals that are set up at the last moment. And it's interesting to me how many women really step up to that call. And I do think that part of it is that this is, again, because of the wartime moment. The wartime moment also facilitated the mobilization of communities to care for their own, because that was the message of the entire uh, era, right? That you needed to be serving your nation in time of war in a multiplicity of ways. And so initially it was by serving in the military, women knitting socks, women joining and becoming nurses to go overseas. And now in the influenza epidemic, you could kind of build on that sense of community service by now appealing to women to come in and administer to the sick so that their communities could survive this pandemic. And it really mattered. If we think of the things that made a difference, obviously physical distancing made a difference, but so did good nursing. Doctors did not have any answers. They didn't understand it was a virus. They had basically no medicines that they could give somebody. They didn't have a way to ease people's breathing. I mean, they tried sprays and they tried some serums and they tried a lot of things, but really at the end of the day, the thing that historians now say made the biggest difference was good nursing. If you got to bed quickly and you had good nursing where you were kept hydrated, your fever was kept down, and again, I think the Porter story really demonstrates that those were the real heroes. Those women were the ones who could save lives. And we always tend to look at the healthcare professionals and focus on the doctors and on the medicines and on the vaccines. But in this case, what we should be focusing on are the nurses, because the nurses made the difference.
And as you said before, and going off that, when we watch the news today about the situation, we hear a lot of bad news, and we hear a lot of very sobering news. And I'm sure people at the time when they were experiencing, as you said, was a very serious trauma, the scope of it and the deadliness of it. But your talk there about nurses and the story you gave us to read about that, it makes folks wonder, were there some heroes that we could look to in this pandemic situation, and individuals or people or groups that you would say, yeah, here's an example from history where we get an insight on what it means to act heroically in really difficult circumstances?
Yeah, well, I'd kind of pick up with, the nursing theme and talk about Lillian Wald. So Lillian Wald in New York City, she was a progressive reformer. She had already been very active in trying to create public health services for the poor, and had already pioneered the idea of a sort of visiting nurse service that where they could treat people in their homes, and these were to help basically the working poor in terms of just the general health conditions that they faced. And it was very easy for her to, in this moment of the influenza pandemic, to build out this idea, work with the Red Cross and other charitable organizations in New York City, work with the Board of Public Health in New York City, and create this whole network of visiting nurses, volunteer nurses who fanned out throughout the city and actually were able to give a lot of the care that I was just previously mentioning. And if you actually look at the toll of the influenza epidemic in New York City and say compare it to Philadelphia, there's a big discrepancy there. And again, it goes back to this idea of good nursing and also some kind of common sense social distancing, that measures that were implemented early enough in the epidemic to actually stem the tide. Whereas in Philadelphia, kind of ignoring advice, having that parade, kind of getting behind the curve, so to speak, and then having to constantly catch up. And so I think that the influenza epidemic really brought to the forefront these local heroes, these people in cities and in towns and communities that really stepped up to care for their own. And I like this story because I think sometimes now we always want to nationalize our story. And this is an interesting paradox where we have this global pandemic. So it's happening around the world. But when we think about how people are fighting it and the heroes that are emerging, they're actually emerging at the local level. Woodrow Wilson is definitely not the hero of this tale. He didn't address it at all. He sort of almost wanted it, in a sense, to go away so he could focus on the war. Instead, it was going to be the mayors, the chiefs of boards of health, the Red Cross. I mean, and these were all people on the community level that were actually having to devise their own solutions. And it is a kind of interesting parallel to today as well, where we're seeing a kind of haphazard regional approach being taken by governors or by mayors or by by school boards. And that's kind of interesting that even as nationalized as we've become and as strong as the federal government has become in the 21st century in terms of our reaction to coronavirus, we're still to be privileging the local, in part because it's difficult to have one size fits all solution, because even today this virus is not being experienced similarly across the country. It's popping up differently at different moments. It requires a little more nimble flexibility in terms of how you're responding to it.
On that question, and what the Grimke sermon suggests this, People at the time, some of them did want to return to normalcy, and maybe perhaps the vast majority did, and wanted to make this a part of the war. And the war chapter is closed, so we're moving on beyond the influenza and the war. Could you talk a little bit more about how people understood the meaning of the influenza pandemic in
Sure.
larger moral terms, theological terms, and if they did, if people shared the view that was in that sermon, or was that sort of an outlier a criticism that many people would not have accepted?
Well, I think that in the Grimke sermon, of course, he's a civil rights activist, so he's trying to draw attention to the cause of racial equality through the sermon that he's giving in terms of interpreting the significance of the influenza pandemic. But people did turn to religion, and they did turn to their pastors to try to make sense of what they had just been experiencing. He's not unique in terms of delivering a sermon to his congregation, trying to understand God's will and the significance of this terrible pandemic, just as ministers and pastors or rabbis are also trying to understand the significance of the war. So in that sense, trying to see what difference this makes. Is religion offering you solace? Is it a way to help make sense of these world events? That I think is quite prevalent in terms of what's going on. So you kind of have, in a way, two sort of different sets of reactions. I mean, one is very secular. Let's try to understand this as a public health emergency. Let's try to understand what this means in terms of moving forward to better protect, excuse me, public health in the future. Understanding how epidemics work and how we can, basically improve the general health of our population moving forward to prevent these things from happening. This connects to traditional progressive era concerns about sanitation, about garbage, about overcrowding in tenements. I mean, all these things that have created health problems in general. Mothers not being well educated in how to care for their children. These things. And we do see public health initiatives like that to address these issues picking up steam in the 1920s. But then, as we see in the Grimke sermon, also attempts to make sense of it more in a kind of existential way. I mean, why would God do this to us? Why would God send this kind of suffering to us? And to try to make some kind of sense of it. I like the Grimke sermon though, because I think that it also points out that, I mean, I've been kind of emphasizing geographically how people experience the influenza epidemic differently, but I like that sermon because it also points out that America's got a very diverse population in it, and different populations experienced it differently as well. And not just in terms of socioeconomic status, but also in terms of their racial orientation or their ethnic orientation. And this could also affect what healthcare they received, for example. People have done studies of San Francisco and looked at public health measures, in a very racially and ethnically diverse city, and found that, when some quarters of the city, like the Italian neighborhoods or the Chinese neighborhoods, experienced outbreaks or large mortality rates, there was a little bit of shrugging of the shoulders. Well, these people are dirty and they don't have good hygiene, and they've kind of brought it on themselves. Whereas in other parts of the city, there was a much more vigorous response. So people didn't abandon all their previous preconceptions about each other and about different demographic groups just because everybody was experiencing the influenza pandemic. And that's what Grimke's saying. You should. You should give it up, people, because we all got slammed by this. So God was telling us we all are in fact the same.
And you mentioned the third wave, and after the influenza of the third wave has come in early 1919, and it's had all these terrible effects on people and on society. The war has come to an end. The question was raised: how did the epidemic end? Did it just run its course, or was it public health measures that did it? Was it the end of the war, or was it all of those things?
It ran its course. I mean, basically, what the speculation is that pretty much everybody got exposed to it, and people that weren't going to get it weren't going to get it, and the people who had experienced it or experienced it mildly had built up an immunity to it, and so it basically ran its course and it burned out. And and there have been, in terms of understanding the virus, there was some medical research that was completed about 10 years ago, where in an Inuit village burial site in Alaska, they found the remains of a woman, and she was in the hyperfrost. So they dug out some affected lung tissue and have actually been able to map the genome of the virus and then also recreate it in a controlled laboratory situation to better study it and understand it. Of course, one of the very big concerns is this never getting out again, because now humans, probably don't have any built-up immunity to this particular virus, and so we recreate it to understand it better. But then that could also maybe be dangerous if, for some reason, that virus ever once got out into the general population. But no, the idea is that it basically burned itself out.
Then, if it reappeared, you called it H1N1.
It's a type of, yeah, H1N1 virus, yeah.
Reappeared then in 2009, for example.
Yeah, that was a different one though. So these are all, the viruses. I mean, that's what a pandemic really is. These are in every year we have a flu epidemic, because there's always going to be sort of new strains of influenza the influenza virus that humans have not built up a natural immunity to. And the flu vaccines help, but they're never 100%, because they're kind of guessing a little bit about what kind of flu virus may appear. And yeah, so that the one in 2009, where 1 million people died worldwide. I mean, that's the next sort of big, the next largest pandemic in terms of fatalities that we've experienced since 1918. There has always been the fear, on the terms of medical researchers, that another pandemic is right around the corner. I mean, this is not, there's never been complacency in the sense of medical science that this could not happen again. I think a lot of the CDC, that's one of the reasons that they continue to research these viruses, that they're creating public health directives, trying to have the WPO that can coordinate an international response in the event of a pandemic. And so there's been, if you read in the literature, you'll see that, I mean, for the last 10 years, medical researchers have been warning about something like this that could happen. And are we prepared? And how could we respond? Well, now we're finding out.
And it seems like, if we're looking at some insights to draw from this, um, besides the obvious thing, which is, as you mentioned early on, take seriously the germ theory of disease. It's, of course, what parents tell their kids. I
Yeah,
tell my children all the time, even
right,
when we don't have this kind of a situation, that to take that seriously,
right.
and then think about, of course, what government actions work. Like, it strikes me, as you were saying before, kind of a swift and early action as necessary. Uh, Now we have testing in the way that we didn't previously
True.
as well. We even have things like contact tracing, where we can trace who's been in contact with whom. And as you say, when Philadelphia held the parade and went on with it anyways, obviously they ignored or didn't know
Mm-hmm.
about those kind of innovations. And it strikes me, one other insight is the importance of citizens themselves
Mm-hmm.
taking seriously their own health and being responsible, and understanding themselves as being responsible for themselves and their own health, and taking reasonable, rational precautions, the kind that you mentioned that's mentioned in the influenza memo, which,
Mm-hmm.
as you said earlier, looks a lot like what we're being told today.
I was laughing when I saw that, because I mean, of course, I've taught about the influenza epidemic for a long time, and now looking back at that today, I mean, you could just retype it and send it out, and the advice still holds. And I think that's, as much faith as we have in medical science. Common sense is always worthwhile, and it seems that a lot of the things that they learned 100 years ago, um, which were, in a sense, kind of hard won lessons from observational experiences, that it still holds today. And when medical science does not have a vaccine, it does not have yet effective medicine to combat the coronavirus, then these common sense measures make a lot of sense. I think that, you know, we're at a moment now where maybe our responsibility to each other and the idea of service to your community and to your country is not an ethos that is widely promoted as it was in 1918. But even at that moment, they had to use some sort of draconian measures at times, either by fining people or sending the police out to enforce the orders to shut down or not to spit. Um, but at the same time, there was a self-policing. I mean, there was public shaming of people. People kind of made sure that their neighbors complied, and it's interesting to see, you know, at this moment, uh, the difficulty that we're having trying to get everybody to take it seriously. I teach at a university, and there's a lot of hand wringing about the millennial generation not really taking seriously social distancing because the message has somehow gone out that they're not going to get it. But of course, they can transmit it to other people. And now I think the research is unclear as to whether or not the younger generation is actually as immune to severe consequences of coronavirus as what was initially thought. I mean, I think we honestly don't know if this is going to be the U-shaped curve, it's going to be a W curve, or it's going to be some letter that that we don't have in terms of what, you know, the fatality rates ultimately end up looking like. But I think that's a good message to draw from this, which is we're all in this together. We're in American democracy together. We're in this pandemic together, and we have to. We have more than just a responsibility to ourselves. We have a responsibility to our families, to our community, to our nation, and that's something that is important, I think, to remember, and something we can draw from this experience.
Well, thank you very much. We've the end of our time. This has been just a really wonderful conversation. I know that we weren't able to get to all of the questions that were asked, but I hope that you've had an opportunity to get some insight here from Professor Keene and her deep understanding of this era and the challenges that America faced. You know, we've got a lot of online resources for you if you're interested in pursuing this further or other topics in American history and government. For more on Ashbrook, feel free to go to our website, ashbrook.org. It tells you a lot about our programs, about the Ashbrook Center itself, the resources we have for students, for teachers, for citizens. For more on American history, we have a wonderful website, teachingamericanhistory.org or TAH.org. It's really the largest collection in the country of primary historical documents, the kind that Professor Keene was directing our attention to today. It's a great resource. It's really user-friendly and a wonderful thing for teachers, students, and citizens to use. So let me encourage you so much to visit those sites. This is, I said, the first in a series of webinars. Next Wednesday, April 1st at 1 o'clock Eastern, we're going to have another one, and it's going to be entitled, How Will History Judge? Presidential Leadership in Times of Crisis. And that's going to be led by another faculty member for our Teaching American History program, Dr. Steve Knott, who teaches as a professor at the United States Naval War College. And he is an expert on the presidency and particularly the actions of presidents in time of national emergency and crisis. So I hope you'll join us for that. We have others planned on topics like the effect of the situation, historical lessons on crisis on economics, the role of states and federalism in the crisis, the question of civil liberties in moments of national emergency and crisis. All of these things that Professor Keene talked about today, we're going to address those in even more depth and detail as we go forward in this webinar series. So we invite you to join us for that, for all or any of those as your schedule allows. You know, these webinars are here to inform you, to give you a historical perspective that you can bring back to today, to think about the issues that we face today. And we hope it will renew your understanding of the principles and history of this great country. And as Professor Keene said, you know, one of the lessons is as Americans, we're all in this together. And we faced very serious challenges as a country before the dark days of the American Revolution, Revolutionary War, the crisis over the Civil War, World War I, World War II. These have been great national challenges that Americans have been able to not only weather, but come out on the other side flourishing. So we hope that's one of the lessons and insights you'll draw from it. American history, we think, is a history of hope. We hope that these will give you some insight into that history and give you some grounds for hopefulness for today and looking toward the future. So I hope that you'll stay healthy, stay hopeful, and stay connected to us. And we'll see you at the next seminar. Thanks very much.
Thank you.
Thanks, Jennifer.
Thanks so much.